everyone, Greta here. So last week we talked about the anterior pelvic tilt causing lower back pain. So today we are going to talk about the complete reverse, the posterior tilt causing lower back pain. Before we begin, please like my video, share my video, and subscribe to my channel just to give me more support. If you haven't watched last week's episode, don't worry so much about it. We're going to do a quick recap. So we were talking about the position of the pelvis causing the discomfort and the achiness in the lower back. So last week we talked about anterior tilt, meaning the arch in the lower back. So this is me when I'm relaxed. So this arch in my lower back can cause a lot of discomfort and pain in the lower back. And so today we are going to talk about the other end of the spectrum, the posterior tilt. So if anterior tilt is the back bend, posterior tilt would be the other way, meaning the rounding of the spinal lot. So if you are constantly doing this, like if you're sitting on the chair, you're slouching a lot. If you're sitting on the floor, you feel like you have to round the back. There's no way to sit up right, or you need like several blocks or more support to prop yourself up in order to have a straight spine, chances are you might be having a posterior tilt in the pelvis. However, that might not be the entire story. Okay, there are a lot of different sides to everything, so just listing out one of the possibilities. You might be wondering, wait a minute, so the anterior tilt could cause lower back pain, but how come the posterior tilt can also cause lower back discomfort? Shouldn't that be much better for your spine? Both ends of the spectrum could be quite extreme for the body, and sometimes it works. Again, I'm not saying that if you have a posterior pelvic tilt, you must have lower back pain or you must correct it. Same as the anterior tilt, if you have that, you are in that pelvis position, and if it doesn't feel anything at all, great, continue living your life. But if it's giving you problem, and if you feel that, or if you have been checked with a medical professional that you do have a tilt that it should be addressed, then we should look into it. Gentle reminder, I am no doctor. I don't have any medical trainings, or I don't have any medical background. I'm not a medical provider. I am a yoga therapist. I've been doing a lot of trainings and studies on anatomy, on pain, and I've been teaching yoga for a very, very long time. It's actually a very long time. So that's why I thought I would share. So what causes the posterior pelvic tilt? Is the lengthening of the lower back. So I'll try my best to create this pelvic tilt, the posterior pelvic tilt, if I can. Here you go. So it's as you can see, the butt is scooped under, okay, comparing to anterior where your butt is sticking out. Okay, so this is anterior tilt in the pelvis, and this is posterior tilt. Okay, so I'm exaggerating so that you can see better, or I'm trying my best to imitate this posterior tilt. So as you can see right here, my lower back the muscles in my lower back is a lot longer than anterior. Anterior is like they're getting really tight. So this is constantly stretched. So when the muscles are stretched constantly and they don't have much support, they're gonna cry for help. So that's the reason why. So how can we address it? Of course, going to see a doctor or a medical professional, they will help you. But then you cannot go to them like 24/7, right? And this is more of a habit of how you hold the body, or how the pelvis is being positioned or being held. So you yourself could also do something to help the body, so that just to alleviate some of that tension. So if this tilt in the pelvis is causing you a lot of discomfort, you really want to address it, you can try out these few drills. A quick way to get that curve in that lower back is to come into a supported bridge. So you can grab a block if you have one, or a few blocks, or if you have a cushion or that's a little bit sturdy, or maybe just roll up a blanket or a towel, that would also help. You basically want something that has a little bit more shape, so when you lay over it, it doesn't collapse all the way. So I'm gonna use this little cushion here. Here, so feet are on the floor. If your pelvis is on a posterior tilt, chances are you'll be here, right? And then what you want to do is just lift your hips up and slide the prop right underneath that lower back close to your sacrum. Okay, and just stay here. You do not need a prop that is super high because we're not looking for a deep back bend. We just want to create this little arch, this little curve in our lower back. So, you know, something about here would be good. Once you stretch your legs out, you would feel a change in your spine. So just take it easy. Some people feel it's very comforting, while other people might be overwhelming. So if this is too much for you, just start with your feet on the floor, acting a bit more support, and just soften all the way. Take a few breaths here. Once it feels more accessible, if you need to, then just stretch your legs out. And this is definitely one of the most relaxing shape to be, and especially to help you to build that arch or that curve in your spine, in that lower back. And what you can also do is slightly engage the lower abdomen, and that is to support the lower back. Yes, we do want to have some sort of a back bend in the lower back, but then we don't want to dump all the load to that part of the body. So by engaging our lower abdominal muscles, it will help to support this arch. And just stay however long that you feel like. Maybe you might even fall asleep here. Once you feel more familiar in the supported bridge, we can do a bit more active exercises just to give those lower back muscles strength again. Lie down on your abdomen, your legs stretched out, and try to keep your feet no wider than the width of your mat. Okay, so just have your forehead down. I like to place the back of my hands to support my forehead. And for here, what you want to do is slightly engage your lower abdomen. Okay, and then you want to lift the leg one at a time. So I'm going to start with my right leg. Stretch the right leg out, keep it long. You want to lengthen it and then lift up. Again, doesn't have to be high. You do actually want to feel the leg becoming straight. So you want to lift your thigh off from the floor rather than just your foot. Because if you just lift your foot up, chances are you might bend your knee and you might not do anything. And also lift the thigh up to the sky. Again, doesn't have to be high. Make sure you can breathe. Lower abdomen slightly hugging in. And then for about 3 to 5 breaths, slowly lower it down. And then do the other side. Lengthen the left leg and lift it up. Using the leg muscles, your glutes, your underbutt to lift. Keeping the leg long. You want to reach it long, so far out that it has to lift up. Again, feeling everything. Make sure everything is breathable. Keeping the front hip bone pressing down to the mat. And slowly come down and repeat. Once this feels quite accessible, you might want to try lifting both your legs up at the same time. Checking everything is stable, lower abdomen hugging just to support the lower back. Okay, and then you want to feel both legs getting longer and then lifting your thighs up. Feeling that the thighs want to hug in. Imagine you have a block or a beach ball in between your thighs. Squeeze, squeeze, squeeze. And then slowly lower it down. Again, lengthen your legs, lift up, thighs squeezing in. Physically, they don't have to touch, but energy-wise, they still want to come into the midline and then slowly release. About 5 or 7 times. Another good one to work on is the Sphinx. Again, nothing so dramatic. We just want to feel the lower back muscles starting to work, starting to get the strength that it needs. Okay, so you are in a Sphinx where you can lace your fingers if you like, or have the palms on the floor. It doesn't really matter. And then take a few breaths, kind of relaxing. Once this feels comfortable, again, lower abdomen hugging in. And feeling that the elbows or your forearms kind of dragging into your hips as you lengthen your ribs up, forward and up actually. So again, starting to use the muscles in that lower back, lower abs slightly engaging, supporting you, your legs pressing firmly down to the floor. So this is not as relaxed as a supported bridge. I mean, it was in the beginning, but after a few breaths, you do want to become a little bit more active. And just stay, make sure everything's breathable. Just a gentle reminder, all the exercises that you do lying on your belly, you do want to feel the body getting long and then lift, and not just lift up from the floor. It's not like a helicopter. I always say it's not like a helicopter going directly up and down, like vertical up and down, but more like an airplane taking off. So that length is very important to create the space. So you might be wondering, okay, like all those are drills and exercises that I have to dedicate time to work on it. How about my everyday life? How about when I am, walking or I'm sitting? Is there anything that I can do? Yes, there is. So we're standing here. Again, your posterior tilt. I'm so sorry, I just can't do it. It's actually a big relief when I have to do this posterior tilt. So you're here. What you want to do is imagine you want to do a back bend. So imagine you want to stick your butt back a little bit. Here we go. And then once you feel your butt is sticking out, engage your lower abdomen and lengthen your spine. Very, very subtle. Keep your knees slightly bent so that you have this area, more space for this area to work on. And then once you're there, then you can charge up your legs again. Here you go. Before it was here, now you're here. How about sitting? If you're sitting directly on the floor or sitting on a chair that you feel you are kind of gonna slide under, you do want to prop yourself up. If you're sitting on the floor, again, a block, a cushion or something has a bit of weight, and what you actually want to do is sit at the edge of it. Okay, so just your buttocks are lifted, but the rest of the lower body are relaxed and grounded down. If you sit too much in to the prop, again, you can see my entire butt is lifted, and there's absolutely no help for me at all because I just want to lift my pelvis, not my entire bottom. So if you're here, you don't feel much, but once you are kind of in the edge, then you can feel the slight lift or slight curve in that lower back, and you can actually lengthen your spine. And that is the same for if you're sitting on a chair. I know that we have a lot of these wonderful gadgets to help us to sit up properly, but then unless they are adjustable, a lot of times they are fixated in one particular shape. So what if that doesn't really fit your spine? So for me, I generally would go for props that I can kind of manipulate and things that are easier to have access to, like pillows and cushions and blankets and all that. If you enjoy my video, please give it a like, share it with your friends and families who are all having this situation that you might think would benefit from this video, and subscribe to my channel if you haven't already done so. If you want to practice with me, DM me either via my IG or my Facebook, and I'll get back to you ASAP. Take it easy.